what it looks like. You're not gonna have any fuchs on the test, but you will have the Duntoid open mouth. And so, but I did want you to see, so you can see in comparison, if they threw it on the registry or something like that, you know that that's a fuchs. How we know it's a fuchs, the Duntoid's gonna be seen within the foramen magnum, automatically where your fuchs will be. Now, in terms of the open mouth, which will be on the test, the key thing that they're looking for on the open mouth is this space right here. That's the sagittal joint between C1 and C2. That's the main thing they're looking for. The other main thing they're looking at is that little triangle, which is called the lateral mass of C1. And so the little triangle is your lateral mass of C1. That's the other main thing they're looking for on the Duntoid. You get those two. Now they want the Duntoid too, but we have this one if you don't get the Duntoid on the open mouth.
What was the first thing you said they wanted?
Sagittal joint between C1 and C2. Alright, so we know this is a Duntoid. You need to include all the names on when I ask you a projection. So this would be, it's an AP projection for a Duntoid, AP projection, open mouth, something like that. But you gotta include all that open mouth for Duntoid with AP projection, because it is an AP projection. And so once you do that, then I'll ask you, we already know it's a service one, your two evaluation criteria, and then we're going to identify anatomy. And so I already pointed out for two things: space between C1 and C2, which is called the what? Sagittal joint between C1 and C2. Then the triangles, told you were
Lateral masses?
those are your lateral masses of C1. Alright, so if I am above, if I'm right in here, right up under the Duntoid, then that's the body of C2. Body of C2. If I am on, of course you know the Duntoid. Shouldn't have to point that out, you should know what that is now. The Duntoid. Then, going back to the joint space, if I am touching the lower ledge,
inferior.
then it's the superior.
Superior's on top, inferior's on bottom. So
No.
the bottom part,
That's your superior articular process.
yeah, that's on the bottom
That's
part.
on the bottom. The superior articular process of C2. If I'm up here on the top of the space, then I'm talking about the inferior articular process of C2, or C1, sorry, C1. Now if you use atlas and axis, as long as you don't get them mixed up, I'm fine with you using atlas and axis. You don't get them mixed up, because they'd be wrong. Alright. Then, if you see this little bone hanging off the side of the little triangles, that's your transverse process of C1. Transverse process of C1. Now your spinous processes of C2 are not so well visible on here, but you can see the little triangle right there. That's your spinous process of C2. Spinous process of C2. And then the only other thing that I'm gonna have you name on here would be the mandible, which is on either side. The mandible. And that will cover the Duntoid, which you need to know for the Duntoid projection.
Is this separate from test?
Yeah.
Separate film test. Film test is Friday. Theory test on Thursday. Alright, next projection. It's going to be the AP axial projection. Don't forget the axial when you write it out. On the AP axial, they want to see at least C3 down to T2. That's what you should see on there. And so, how you count it is, you can start, that's T1, because we got a rib. So that's 7, 6, 5, 4, 3. They got a little bit of 2 on there. So as long as you see C3 down to T2, you should be good in terms of the quality of the image. Now, in terms of anatomy, of course, you got to do the same thing. Projection, evaluation criteria. then your anatomy. If I'm going down the center, if I'm marking several things down the center, those are your spinous processes. I won't hold you to which one is which, because it's kind of hard to determine when you're from the AP projection. All right, but you do need to know that they are spinous processes. You do need to know which vertebral body it is. And I just pointed that out. That's 2, 3, 4, 5, 6, 7, T1, T2, T3.
So T1 is the first one, ribs and outside.
Exactly. All right.
So you're better off going from the bottom to the top.
However you want to do it. Strictly up to you. All right. So then, if you look off, you see the little circles right here. That you see off this? Those are your pedicles. Pedicles. They support your articular processes. Your pedicles. The little circles you see off to the side. Those are your pedicles. If I am on the body, I'm gonna be off to the side of the spinous process, and that's when I want you to identify which body. If I'm in between the two body spots, then I want you to know the intervertebral, this space in between which one and what. So if I'm here, I'm between T2 and T3. I'm here, I'm between C6, C7. If I'm here, I'm between 4 and 5. From here, between 2 and 3. Those are intervertebral disc space. Intervertebral disc space. Also, in addition, some other items that I may identify on this x-ray. You got clavicles, your ribs, that's rib 1, 2, 3. You see this little bone that's coming off here, that's your transverse process on your thoracic spine. But if you just say transverse process, I'll be good with that. They're not as prominent on the cervical. It only starts as you get down to the thoracic, down the lumbar. The mandible goes with those two things. It's actually right here, your mandible. So at this point, just mandible. I mark that. And that's pretty much it on that one.